Lord Bishop of Bristol.
My Lords, the North Bristol NHS Teaching Hospitals Trust has recently reported on an audit of 110 patients discharged after being severely ill with COVID-19. Of these, 75% were still experiencing serious symptoms 3 months later. This is just part of the mounting evidence of the long-term effects of COVID-19, even on those with mild infection in the acute phase. Can the Noble Lord, the Minister, tell the House what steps the government is taking to raise public awareness of so-called long COVID and to invest in the care of those now chronically ill?
The Right Reverend Prelate is entirely right to raise this point. It is something that is emerging as being one of the massive concerns. The idea that COVID will somehow pass through Britain and leave people untouched, and it's a bit like simple winter flu, is beginning to be worryingly untrue. And the anecdote she tells from Bristol is completely consistent with what we're seeing across the piece. In particular, those who have had an acute infection. But also, I'm afraid, Noble Lords, there are some who have had relatively asymptomatic or low symptom COVID flu who have found in later weeks and months symptoms of fatigue, arrhythmia, renal impact, scarring on the lungs, memory loss. These are extremely worrying symptoms. So Patrick Vallance, the Chief Government Scientist, is running an operation to understand as the Right Reverend Prelate rightly calls it, long COVID. We are using big data to analyse the scans that we have collected from acute patients and also to understand the impact of asymptomatic infection. But this is an extremely worrying manifestation of COVID, one that we are acutely aware of and we are investigating very, very urgently.